Workers in South Africa had initially complained of the lack of support gear and related resources to carry out their duties in the battle against COVID-19. As things stand, though, they have engaged management to try and resolve those issues. We've asked Tumelo Mogodiseng, the General Secretary of the South African Police Union, and Doctor Kgosi Letlape, the President of the Health Professions Council of South Africa. They are both on Skype to give us some insight into the daily challenges of their members on the ground. Dr. Letlape and Mr. Mogodiseng, a very good evening to you both, gentlemen. Welcome to the Globe.
Evening,
Dr. Letlape, I'm going to start with you. Good evening to you. Thanks indeed for joining us. Well, I'm going to start with you, Dr. Letlape. Can you take us through the kind of challenges that healthcare workers face on a daily basis? I would imagine there's increased and long hours and maximum exposure to infections.
Yes, I think the challenges relate to the facilities are not being kept. So the availability and even enforcement and enlightenment administrators, the different institutions is at different levels. The commitment to protect frontline is not the same from institution, and it's not the same in the private sector. And we need to ensure that organization and uniformity and enforcement of a safe working environment.
When you speak of uniformity, do take us through what you mean by that. Are you suggesting that some institutions or some kind of medical environments are treated differently from the others?
No, I'm saying we are applying different. What we should be seeing in all institutions, everyone that's on an institution has their mouth and nose covered. All the people that work should be wearing surgical masks or N95. All those that are visiting should be having at a minimum. People that work in areas that receive COVID patients or persons under investigation must have full PPE where appropriate. So gloves, gowns, shoe covers, eye shields should be readily available. And healthcare professionals that are engaged with taking care of patients that have COVID-19 have to be supplied with full PPE. That means being covered from head to toe, including covering your head. They must also be trained on how to put PPE on and how to take it off.
Certainly, Dr. Letlape. I mean, what you're telling us is certainly not something new. It's concerns that have been raised by healthcare workers, especially those working in the front lines. It's concern raised by their families and broadly by members of society that frontline workers, nurses, doctors need to be provided with such PPE. So this has been raised with the government authorities. So are you at all satisfied with the kind of response in terms of the allocation of resources?
Well, what we have seen is a serious attempt to acquire PE. We've seen shipment from donations from. We've seen PPE procured from the Solidarity. We've seen the minister acquire PPE. We've seen donations come from the People's Republic of China. But what we need to ensure is that all the materials filter down to the points of care and that it is ready in all institutions. And that in an institution, there's proper designation that this hospital is a full COVID hospital or it has an area to receive COVID patients, those under investigation. But even in the other general use, there should be full infection control. And given the fact that, and this is a pandemic, all people in the institution must be wearing masks, a minimum. Availability of points where you can wash your hands as frequently as possible with the abundant. Sanitizers should be made available everywhere. We also need to ensure that outpatient department and doctors' surgery are also COVID compliant.
Right.
All areas where they are professional, whether it's a therapist room or any other healthcare practitioner, has to ensure it attains the minimum standards that are expected the times that we live in.
Dr. Letlape, I'll chat to you in just a moment, so please stay on the line. Mr. Mogodiseng, let me just bring you into this conversation. The last time I chatted to you, you had lamented the fact that police officers all over the country still do not have sufficient PPE, as they are also in the front line in a way, because they're also dealing with people potentially who might be infected with coronavirus. Now, what is the status with regards to that? Are you at all satisfied with the level of response? I mean, in terms of the allocation of resources, I see that some police officers, if not all, now have masks on. Now they now have gloves on, but then not much is being said about social distancing, because as I was trying to work just an hour ago, I was stopped by 5 police officers in one van. So that it tells me that social distancing is still not something that is practiced.
Yeah, thank you, Simpu. It's so sad what is happening at ground level. Members are left to fend for themselves. We are not happy, we are not satisfied what we see on the ground level. You get your sanitizers that are delivered in 20 liters. Members at the station have to find some smaller containers. The very same gloves that have been distributed, they are oversized. Look, the morale of the members is so down. The commanders are confused. There is no moral support from the commanders. Your EHW, employee health workers, that have to support the members, your chaplains, your social workers, are not there at ground level. You can talk to the members as part of their job. We have been saying this as a union, that we need to capacitate this department so that it can be able to deal with situations like this. So we can confirm as a union that we are not happy about the situation at ground level. The morale of the members is not that very same PPE that is at ground level. We are not happy. There's still lack of distribution. It clearly shows that there is a lack of management in the SABC. I mean, how do you start distribution? The issue of distancing, we can also confirm that members are so packed up in their vehicles, so it's hard for them to comply with social distancing. Hence, as a union, we are engaging with the legal team, see what is the legal route that we can take so that the employer must account for exposing our members to this dangerous situation.
And there's also the issue of police brutality. Now, a joint police and army patrol in Alexandra and Johannesburg were caught on camera forcing several men to perform squat jumps and roll on the ground simply for being found on the streets and not staying at home. I mean, how do you respond to such?
As a union, we are on record that we strongly condemn the alleged brutality. Hence, we cannot trial members of media. We need to investigate and make sure that you are proven innocent until you are innocent until proven guilty by the court of law. But again, we need to reflect on the disappointment by management. They have issued an instruction to say the members have to be dealt in terms of Regulation 9, expeditious process, when allegations like this comes in. Look, you are further demoralizing the members. How are you going to expeditiously deal with the members, whereas you are not sure about the allegations? So these are the allegations, as a union, we strongly condemn the alleged police brutality by the police or the soldiers. Don't support this. We are a democratic society. We need to respect the society and make sure that we do our job within the ambits of the law.
So how then are police officials expected to enforce these regulations without applying force, without being brutal? What is it that they're expected to do?
Police are trained to handle any situation. Professional policing is a must in a better South Africa. So they know when the right time to end each and every different situation. We cannot say police brutality should be used to enforce the regulation. We are saying they are professional, they must respect. We don't want to be reminded of the dark days where the police were regarded as the enemies of the society.
Now, Dr. Letlape, let me also bring you into this conversation. We've seen so many health workers and in particular doctors and nurses being infected by COVID-19. I mean, there's a high rise of infections among the healthcare working staff. Will this not perhaps derail the healthcare workers? Will it not perhaps demoralize them into executing the public mandate?
It definitely will. But the major concern with regard to that is the lack of support for the frontline health workers. We've spoken about institutional sufficiency and PPE, but when people are under stress or people get infected, they are then on their own. And that is a serious gap where we expect healthcare professionals to comply, to take care of society. There's a neglect in terms of the healthcare professionals. We actually neglect ourselves. And now that you've raised that point, I would like to challenge SABC and all its families, the radio stations, SABC 1, 2, and 3, to support me in starting a campaign for the support of the frontline COVID-19, so that they could have support in terms of psychosocial support, information about COVID, education about their responsibility, so that they are empowered up to the oath that we take. But they should also have the comfort that if they get infected, they are not on their own. They are supported. We negotiate with the department and the employer about the support that they need, support to their families, and maintenance of their mental health. This is an area that is neglected because it's not anybody's mandate. So as an individual and as a practicing professional and as a leader of the health council, but I put the challenge to you in my capacity so that practitioners, we should put our hands in our pocket, support one another. And I will challenge the SABC to partner with me, and we look at other people supporting the healthcare workers and all others that are in the front line of it.
You make a valid point there, Dr. Letlape, but then in what form or shape do you expect this kind of campaign that you're mentioning should be?
You know, money talks, other things walk. Support health workers. You need to be able to help mobilize mental health, support them, ensure that if they need testing, they need support, they need treatment, those things are available to them. We've seen Old Mutual have the proposal of 10,000 beds for a funeral. I'm suggesting to ensure that Old Mutual does not even pay a single 10,000 rand. None of our people in the frontline have to die while helping society. We know that that might is missing is proper support, their morale, ensure that we have their back. I think global people come to hoot and clap. But when you read their story after their 8-hour, 12-hour on their own, they have to come next shift. That's the gap that we need to cover.
All right, please stay on the line now, Dr. Letlape and Mr. Mogodiseng. Let me just bring you again back into this conversation. It seems there's a new battle now, police officers dealing with the illegal sale of alcohol. Will this not perhaps derail you from enforcing these regulations?
Simply, we first want to make the very same call as Dr. Letlape that we need the public to support the police. The police, when they are on the street, they are there to protect the interest of the country and of the society. Police also have families. Police have brothers and sisters. The least that we can do is to support them to boost their morale, because of they are not supported by their own management. They are not being promoted. You find some of the members are sitting on the rank for more than 20 years. How do you expect a person's life to be stagnant for 20 years and you expect this particular person to perform to his or her ability? So we want to make this call to the society that the least that we can get from it is to give us the respect that the job that we are doing is to protect you. So the challenge of policing this regulation is easy, but the challenge will be when we don't get the proper directive from management itself. For an example, we had a situation with the mines where the mines were allowed to operate without proper directives. And the police were expected to go and stop the miners not to report on this. And it is not part of their mandate. The mandate of the policing is to prevent crime, is to combat crime. So these kind of regulations that are confusing, we are happy that it's been clear that there's a 50% that of the miners going to work. But you don't expect police officers to count miners to say how much is 50%. So the challenge here is about direction for our leaders to make sure that the members at ground level don't happen to be the casualties, and they are being charged for that, and they are expeditiously dismissed from the service.
All right, Mr. Mogodiseng, I think you're rather shying away from the issue of alcohol, yet it is a very, very important issue, as Collins Khoza, an Alexander resident, also lost his life. I think it's incumbent upon you, upon the police service, and upon your members to tell us what is an offence. Is it being caught with alcohol on the streets or in public, or is it in possession of alcohol within your own yard and within your own house? Because Mr. Collins Khoza lost his life as a result of that, being caught with alcohol in the confines of his own home.
Simply, I'm not in a position to comment on the alleged incident. But what we can say
I'm not talking about that incident in particular. I just want you to tell us, is it an offence being caught with alcohol in your own home?
The regulation speaks of the selling of the alcohol, transporting of the alcohol. That's what we know. That is in the regulation.
All right. Dr. Letlape, let me just come back to you. You mentioned the information dissemination, that the campaign that you envision South Africans and the media to uphold is the information of, the dissemination of information. With regards to that, then, as we've seen earlier on, South Africa has now set a target of screening 1 million people per week. I think it's important for you to tell us what is the difference then between screening and testing, because so many South Africans out there, they don't know the difference, because having been screened, they think that they've actually been tested and they would go on infecting other people unknowingly.
What happens is that because of the cost implications of testing, we need to select who gets tested. If there was no challenge on availability of tests, we would test everyone in the country. But as you've seen globally, there's a shortage and there's competition for effective tests. So screening, it's a general thing that's done in the population to select the ones where testing would be more appropriate or needed. So in screening, they'd be taking history about your contact, symptomatology. Have you traveled? Have you been in contact with someone with COVID? Have you been in public gathering where someone was found to be positive? And those that are in that appropriate test would then be tested. So screening is just broad, where we do everyone selected, and we'll then pick up those that we think are at risk of being carriers, having been infected with COVID. Remember also that we have a problem where we have asymptomatic carriers.
Yeah.
So you can have COVID without having traveled, having just picked it up in the community, without having been in. So as we acquire more tests, broaden the net, the people to be tested. Okay. So when you are all instances that you have found to be very low risk or not at risk, found to be at risk, you then proceed to being tested. And when you are tested, start negative, not being picked up now. But remember also that if I was exposed yesterday and I tested today, the incubation period is 2 days. So I might still be out of it.
Okay.
If I develop from even though I tested, I must avail myself a healthcare facility so that they could do further investigation, isolate me, and do whatever is necessary.
All right, please stay on the line once again, Dr. Letlape. We'll certainly continue the conversation in just a moment. Mr. Mogodiseng, just before I let you go, you've made a plea to the government to supply police officers and officials with PPE. So what is it that you want the president to do for you now, if the president is watching right now?
We would like to call on the president of the country to support the police by making available the places for the members to be quarantined. The members cannot afford to buy decent houses. If it happens, these members test positive, they won't have any place to isolate themselves. Can the president make places like he did with the people who brought from China to quarantine somewhere there in the range? We would like to see the same thing, the same treatment to our members to show at least appreciation that we value you, we appreciate the job that you are doing, going outside there while other people are locked inside their houses. The members cannot afford to buy decent houses. Please provide them with decent places so that they can be in quarantine.
All right, Mr. Tumelo Mogodiseng, the Secretary General of the South African Police Union, thank you so much for joining us. Now, before I let you go, Dr. Letlape,
Thank you so much.
yeah, just picking up on the issue of testing, how would you envisage a situation where people voluntarily go for mass testing, looking at the high cost of testing as it is now?
I think those matters will be controlled by the NIC and the Ministry of Health. So as the information of the testing that has been done, the millions of people that have been screened, and the yield of those that have been tested, they will then create a step of how we roll it out. As more tests become available, more testing will Remember that before you can release the lockdown, you need to have a better sense of the rate of infection in the community.
Yeah.
But there are other issues that I wanted us to talk about. The issue of the welfare of practitioners, the issues that have been raised by the representatives of the union. When people in the front line, we need to provide them with support that is needed, and they need to access the care that they need as quickly as possible. I've been taking calls from members of the profession that are concerned about issues of litigation and being sued in times of a pandemic. We have released communique that says and now that is prescribed, in particular for specialists. Remember, for doctors, we are general doctors become specialists.
Okay.
So when there's a need, it's been relaxed. So as an ophthalmologist, I assist in the general areas and in COVID, but I have to assist the competencies that I still have. It requires that there be an announcement of the issue
Dr. Letlape, I'm afraid the line is gradually deteriorating. I'm really struggling to hear you. But thank you so much for your time, President of the Health Professions Council of South Africa, Dr. Kgosi Letlape, and as well as Tumelo Mogodiseng, the Secretary General of the South African Police Union. Thanks to you two gentlemen for joining us and for your thoughts. Much appreciated. And the Globe will continue shortly after this break.